Yeah, on a mental health side, I mean, there's that clip of that. I think a primary care physician or maybe pediatrician in Arkansas saying that she will call every time a child is admitted to the emergency room for suicide attempt. And we know that the suicide attempt rate in the United States is somewhere around 54% for trans folks. That's attempt. And that number goes back down to the national average when you have meaningful support from family. So there's nothing inherently wrong with trans folks, right? It is the society of transphobia that causes this. It's also media messages that also really cause this too. We know that this legislation will be deleterious to people's mental health. What we also know, though, is that trans people have superpowers, right? I, as a trans person, spent most of my life compartmentalizing in a little box that I was not a woman. And that takes an enormous amount of strength to be able to operate through the daily world and be able to compartmentalize part of your life, right? It makes me a really good compartmentalizer when I need to be. I am very good in emergency settings because of that, right? Other people have other superpowers too, about just the resilience that they bring to the table, just the ability to create chosen family when chosen family is not there, or when family's not showing up, really. There's so many beautiful, strong parts of trans folks and the LGBTQ community in general. And that resilience is what I like to emphasize, is that yes, people are negatively impacted by this in a really profound way, but the more that we can shift the narrative in healthcare to the strengths-based approach, the more we can also encourage our patients who are experiencing that direct transphobia, who are getting those messages, to instead be able to feel empowered, right? And I think that helps to limit the spread of this myth that if my kid becomes trans, we were talking about this today, right? They will be harassed their whole life, when that's just not true.
Yeah. Yeah, I mean, I think, yes, it's horrible. I think we can all say, we all know there are kids, the parents I know around the country who were having to tell their kids, no one's going to take away your medicine. We will figure out how to do it. There are families, I was reading a story the other day about a family that actually left Arkansas because of it. And I know families in Texas and Montana who are thinking of doing the same thing. I also know parents who this has made them into forces of nature, that it goes to this primal level of, I will protect my children, that they wouldn't have done before. And this is especially in families with a certain level of privilege who never have really thought of themselves as someone could take away my right to medical care. I mean, just think about it. If someone said, like, yeah, tomorrow in Colorado, you won't be able to get insulin anymore, and your doctor will go to jail if they prescribe it to you. Like, what? That's the level of honestly what we're talking about, because gender affirming therapy for kids is life-saving, period. We've got tons of data on that. And so parents they knew that, but this internalized it for some of them. And the wave of support and activism that is coming out of this, and that has come out of it, is amazing. I know when the laws started to come out and started being proposed, it was amazing, the response I saw among medical providers too. The number of people who are like, can I get a license in Arkansas and go write prescriptions on the street? Because I'm going to do that. Or I'm going to go stand on the state line with my prescription pad. And because these are life-saving parts of medicine, it will continue to happen. And no matter what happens in states, And so I think that kids see that trans people have seen that, and it can give them a little hope of, okay, I have fought and fought, finally someone is fighting next to me.
And I think that's exactly it. And, just listen to the words of Governor Asa Hutchinson from Arkansas himself. He said, this law is going too far and it gets in the middle of the clinician and the patient and the family, right? At the end of the day, no matter where you fall on gender affirming care, this is a dystopian overreach of government to say that government gets to dictate against scientific evidence what care should look like. And I would really worry about what precedent legally this sets for any other area of healthcare.
Yeah, I think healthcare in general really needs to look at this, because if today it's we're going to make, gender affirming healthcare illegal, what is it tomorrow? What specialty will be affected? And it will be another one, because there's always a new area to assert power over. And there's always new people to fight against that